So thanks very much for being here. I know you've had a long couple of days and you've talked about a lot of complicated and challenging topics. And so we thought we would end on a lighter note of domestic violence. Obviously not quite so much, but hopefully we'll be able to talk about it in a way that's engaging and at least relieves some of the anxiety that this topic brings up for most people. That's my primary goal in this conversation, is to help to give you some space to think about these things and talk about these things in a way that is helpful for you to be able to keep doing your job effectively, and for the people that you see in your home visiting practice that will give them the resources and access that they need. With that in mind, though, I want to make sure to be clear to start out, because relationship violence is so prevalent in our culture, and we'll talk a little bit more about that later, it's a wise idea to assume that there are survivors in the room right now. And so please be aware of that when you're talking. Just be careful about what you're saying, and if you need to take care of yourself in any way, please don't hesitate to do that. If that means taking a break, taking just a step away, the star, right? Stop, take a deep breath and relax. Whatever you need to do is fine. It also means if you have any questions for me or concerns for me, or uncertain about something I've said or something someone else has said and you want some clarification, just raise your hand, call out, whatever. The more interactive this is, the more effective it's going to be for everybody. In addition to that, please do the best you can to respect confidentiality. It doesn't mean what's said here stays here, right? This is a training. So if what's said here stays here, it's a very poor training model, right? But what individuals say, please don't go out and say, hey, well, Susan said, right? That's a little bit more problematic, right? So very simple, basic, straightforward ideas, right? Let me start just with, I'm going to back that up, just a basic definition of domestic violence. What does that mean to you? Anybody, just call it out. Control, okay. What else? Manipulation, sure. Isolation, sure. Okay, I'm going to go ahead and put this up here, please. Physical, absolutely. So this is the definition that we generally work with. And we, I mean Oregon Health Authority. Also, this is a Futures Without Violence-based curriculum. You're probably familiar with Futures Without Violence. They're a great organization. I do not work for them. I need to be very clear about that. But I wholeheartedly endorse them. I think they do incredible work. So what on this definition stands out to anybody else? Anything you note here? In a relationship, violence between two people in a relationship, sure. What else? The word for me that stands out more than any other is actually the very first word. It's a pattern, right? It's not an individual moment. It can be, an individual moment can be part of it, in fact, necessarily is, right? Patterns are made up of individual moments. But one individual moment does not define a relationship as a general rule. And which is very interesting given today, or the last couple of weeks, news that we've been seeing, right? The stories about Ray Rice and his assault of his then fiance, now wife, in an elevator. That one instance, although clearly an assault, well, at least from what I know, I'm not a lawyer, I don't even play one. It seems to be pretty clearly an assault. Whether it would qualify as domestic violence is not actually necessarily clear because it isn't necessarily a pattern. We don't know all of the story, right? And so how does that play out? Well, it gets a little bit complicated. And it's interesting because it gets complicated in a couple of ways. One way is that maybe it isn't domestic violence, although again, it is assault. But also, one of the things that seems to be happening now is that because we've seen video of such a brutal assault, one of the things I'm afraid of is that that's getting defined as this is what assault looks like. So if you don't get knocked out if you don't have it on video, if you don't, like, there are all of these disqualifying components that seem to be stepping forward. Domestic violence doesn't need to look like that, right? It can be much more subtle, but the key is that it's a pattern, and as people said here, it's a pattern of manipulation, of isolation, of physical abuse generally, but not always. It can also include, as you see, economic, emotional, and on down the line, right? This is all part of what the experience of domestic violence looks like. And the last word, so I talked about the first word, and the last word, isolation, is such a key component of it, and I'm so glad you pulled that out, thank you. That's what distinguishes domestic violence more than anything else, is that the person who is in an abusive relationship feels alone. And so why it becomes then so important that we pay attention to that, home visitors are often among the few people who have access to that person in a way that can bring resources and hope to the individual in the relationship. So that's the value, that's the importance of having these conversations with you here today. One of the things that we've been spending a lot more time talking about recently is the concept of reproductive and sexual coercion as a component of domestic violence, right? And you know, it's big and complicated words, but again, it's fairly straightforward. It's behaviors that a partner uses to maintain power and control in a relationship that are specifically related to reproductive health. So again, as you can see in your day-to-day work, it's relevant, right? This comes right into your wheelhouse. One of the main projects that I work on at the Oregon Health Authority is a grant called Project Connect, which is focused on supporting the work of reproductive health clinics in doing screening for intimate partner violence and reproductive coercion. So that's connected to this pretty directly, as you can see. So this is an expansion or a continuation of that work that I do on a day-to-day basis. But reproductive coercion can be in either direction, right? It can be trying to force someone to become pregnant, or it can be trying to force someone not to become pregnant, right? It's about taking away someone's options and control. In fact, and even after pregnancy, that continues, forcing someone to continue a pregnancy or forcing someone to terminate a pregnancy, the same sort of thing. Have any of you seen this before with clients or patients that you've worked with? Have any of you heard people tell stories? I'm seeing a few nods and a few hands. So this is something that's not a big surprise to you. Amazingly enough, it's something that we as a movement, the domestic violence movement, haven't talked about a lot before. It's only in the last few years that this has really come up as a significant issue, something that we pay a lot of attention to. So we're moving in the direction of recognizing this as its own form of abuse, its own form of concern that we'll pay attention to and try to find a way to prevent and change culturally. So what do we know? This is one of my favorite statistics because it's the gap or the range is so broad as to be almost meaningless, right? You see between 14 and 52% of home visited perinatal visits clients experienced domestic violence in the past year. Well, between 14% and 52%. And this is an estimate, right? So there's a margin of error, which I would guess, given that it was a relatively small study, I don't know this, but I would guess the margin of error is probably in the range of 5%. So it's really between 9% and 57% more likely, so even broader than we're seeing here. But when you look more closely at these numbers, the single biggest factor that seems to indicate where someone falls on this is whether they were asked the question. And it's not surprising, if they were asked the question, they tended to be on the higher side, right? So the more frequently we are asking these questions, the more frequently we're finding that people are disclosing to us that they're experiencing abuse. So again, what that means, back to, as Annette was pointing out, the measure of success in this program is not disclosure. We're not going in and saying, oh my, I really hope that they've been abused, right? That's not our goal. Our goal is to ask the question, to make sure that we ask the question in a way that's as effective and likely to support disclosure if that's what's needed. Does that make sense? Any comments or questions so far? Okay. So here, I just want to ask you to think for a minute, and you can either write this down. This is only for your own use, but just a way of measuring your comfort level in talking about domestic violence, intimate partner violence with your clients. So if you can just, again, either actually do this or do it in your head, just draw a little comfort meter, a meter. And on the left side would be not at all comfortable. On the far right would be extremely comfortable. This is second nature to me. And place yourself somewhere on that meter. The idea, of course, is at the end today, I'm going to ask you to look at this again. My goal is that you'll have moved, hopefully to the right. That's what we're looking for. The idea is that we want to get people to be more comfortable, to be more likely, not just to ask the questions, but to ask the questions effectively. Okay? Clear enough? So this is a question for you all. What is the role of the home visitor in terms of addressing domestic and sexual violence with their clients? What's your role? Why am I here today talking to you? Provide resources and support. Did you have something additional? Okay. Please. Education. Okay. Often, and we see this pretty consistently, people aren't even aware that they're in an abusive relationship because it becomes so normalized, so much a part of their lives. And so our role is to help them to recognize that there are alternatives. It doesn't have to be this way. Is that fair? Okay. What else? I'm sorry? Safety of the child, enhancing the safety of the child. Absolutely, and particularly in the home visiting program, that becomes really key. Anything else? Hope. Who said that? Thank you. I thought that was you. So can you say more about what hope means? One of the most powerful things we can give to our clients is hope. You said on any issue, and particularly on this one, hope that they have an alternative, hope that they can leave, and I really appreciated that you added on the end of that, if they want to, right? I have to admit, personally, my preference would be for a client to leave if they're in an abusive relationship. But it isn't my decision, right? That's my view on things, and there are reasons that that's useful and helpful, and it's still not my decision, right? And so that's one of the places that I struggle, and I imagine it's one of the places that many people struggle around this. It's not our role to get them out. It's our role to give them support in whatever decision they make, to help them to do safety planning potentially, or even more likely, to connect them to resources who can help them to do effective safety planning, right? Okay, thanks. So what are the negative impacts of domestic violence in people's relationships, in the lives of your clients? Depression? Stress? Others? Attempted suicide, which is connected to depression, but also its own thing. Kids are more likely to have negative outcomes in their own adult lives as well as in their developmental lives. Sure, the negative impact on children, very, very high. Homicide in both directions, right? Either the partner who's being abused killing her abuser as a way of protecting herself, and I use the feminine pronoun in this context because since it's a mothering program primarily, that's appropriate. Domestic violence doesn't only happen to women, as we know, but in this context, it seems like it does. But also, of course, the murder of the survivor is very I suppose she wouldn't be a survivor in that context, thank you, of the victim. This is one of the real challenges, right? In an effort to empower people who experience domestic violence, we use the word survivor, and sometimes it's not the appropriate term, as just happened, and I appreciate that the response was somewhat comic relief as opposed to just real awkwardness, right? Because it can be either in that moment. So we also know that domestic violence specifically can reduce the effectiveness of home visits generally, because if the person feels completely isolated, feels like she can't trust anyone else, can't disclose what's going on in her life, then you can't make an assessment as to her needs generally, right? We also know that, as I said earlier, home visitors are often among the only people that survivors can turn to. And what we know is that the two most likely people that domestic violence survivors turn to are clergy and healthcare professionals. And in fact, it's in the reverse order. Healthcare professionals are number one, clergy are number two in most of the research that I've seen. So you are usually going to be the first line of request for support. And if you're prepared to respond to that effectively, dramatically increases the likelihood of a positive outcome, again, as defined by the survivor. And I'm going to keep pointing to you because I think that's such a critical piece, probably the single most important thing that's said today. So thank you, at least in the 2 hours here. So thank you for that. So this is what we're talking about. Assessment and safety planning for domestic violence in home visitation. Fairly straightforward. This is what we'll be keyed in on. Our learning objectives, we'll talk about barriers. We'll demonstrate how to discuss limits of confidentiality. We'll talk about using the safety card. And by the way, you have a safety card in the little plastic binders that are included in your packets. And I didn't bring one up front with me, but yes. It looks like this, and there are a bunch of them in the back, as Robin said. There's a version in English and in Spanish. And I will tell you by the end of this how you can get more of these than you could ever hope to have, free of charge, except that there's a small shipping fee. Futures Without Violence puts out tons of materials that are free. They do charge shipping, as I said. I believe it's a $10 flat rate, pretty much whatever you order. So you can get lots of great stuff there. And we'll talk about action steps that you can take for a safety plan if that's indicated. So we're going to have a group discussion here very quickly. Starting and ending these conversations can be very difficult, right? Can be stigmatizing. And so that can be really challenging in any setting, whether it's home visitors or others. And we take care of ourselves by finding ways to present these questions and messages in ways that make us feel comfortable, right? That's just normal. That's perfectly reasonable. We need to be comfortable in order to talk about something, right? Anyone disagree with that idea? Okay. Fair enough. So has anyone here ever had a form that they were required to fill out, and it had, there are questions I'm supposed to ask my client, and they've changed the wording or the order of the questions as they were asking them in TV screening? Ah, look at that, we're back. So can you tell me, if someone asks the question, no one's hurting you, right? If you'd like, I'll take it from here. Suddenly it gets really awkward, right? Okay, I think I might be blushing. Oh, I love that this is being videotaped. So no one is hurting you, right? What's the answer to that question? Right? No, of course not. Right? So that's very comfortable, much more comfortable to ask that question than to say, have you ever experienced da-da-da-da-da-da, right? We can go down the line. And it's obviously intended to elicit a particular response. And amazingly enough, it's very successful at eliciting a very particular response. irrespective of the reality of the situation, right? So look at these other 4 and tell me what you think. Any comments about any of them? How do they work? Are they likely to bias the outcome or the response that you give? I'm seeing nods. Can anyone give me a specific example? Okay. So in 3, 4, and 5, the words domestic violence, abuse, and safe are all sufficiently vague that they mean dramatically different things to different people. I used the Ray Rice example earlier. Well, sure, he hits me, but he's never knocked me out, so I must not be being abused, right? So there's some risk in our language, if we're not careful, that's kind of a surprise, especially the 5th one, the word safe, even the word safe. Well, yeah, it happens every day. It's how I live, right? So of course I have to define that as feeling relatively safe. Okay. What else? Please. They're all yes or no answers, which is a little bit complicated, right? Our lives are much more complicated than yes or no. Thank you. I think I saw. Okay. Great. Okay, I saw a hand here, but I'm not sure who it was. Was it you? Okay, look at that. Everyone wanted to say yes, no. I like it. Anything else? The other thing that I notice here, the words domestic violence and abuse, in addition to being fairly vague, are also deeply judgmental, right? And so if we use the more neutral terms like safe, and I agree safe isn't perfect, but I think it's a heck of a lot better than domestic violence or abuse. Because that's terms that we use in clinical contexts that have such strong emotional meaning that people are not likely to attach themselves to it quickly. Sure. Anything else about these? Number 5, in particular, is one I like to pay closer attention to because this is one that often gets identified as a good choice. And I would agree, of the 5, it's the one I would recommend most. But there's something else about number 5 that sticks for me, which is, well, there's a leaky ceiling, and the floorboards are kind of loose, and, right? What does it mean to be safe in your home? Right? That's not about the relationship. That's about structural integrity of your home, right? Potentially, right? So again, our languaging is very valuable, and we can come up with a lot of different ways to talk about this. And one of the things that I love about this card is that you get a lot of different options. And we'll be going through this card in a lot of detail as we move forward. But you'll see the card really goes through these in some substantial depth and gives you some suggestions for how to talk about these issues in a lot of different ways. So I really recommend it and encourage it. It's always a good idea to be aware of what doesn't work, what we know doesn't work as we're moving forward. So here are some suggestions about what's unlikely to work. And people who know me in the office hear me on this last point talking about this all the time. But as we get there, so the first is expressing doubt to the person, not surprising, isn't going to be terribly welcome, and again is likely to lower your degree of trust or their degree of trust for you. So just being aware of that. Judgment, why didn't you leave earlier? Why are you staying? Why didn't you tell anyone? All of these questions, right? It's not your job. That's not why you're there. Blaming, I think relatively self-evident, and yet very easy to do, right? You made a decision that's different from mine, and therefore I want to know why that is. Well, you want to know is different from you need to know, right? So figuring out how to do that. Again, minimizing, I talked about that earlier. He's hitting you, but he's never knocked you out, right? That's the kind of minimization that we often see. Interrogation. Again, not so much your role to do the talking at that moment. You're much more effective if you listen and then provide resources. And then finally, this is the one that's one of my favorites, is should. The word should carries so much baggage behind it, and it gets in the way, particularly for people who are experiencing violence in their lives. They are often, not always of course, but they are often feeling dramatically shoulded all the time. Someone's always telling them what they should do, what they are doing wrong, why they're bad, why they're ineffective, why they deserve to be hit. And if we, as people who are hoping to support them and help them, come back and again tell them what they should do, then in some ways we really run the risk of reinforcing the very message that they're not good enough. So if we can find ways instead to talk about what they could do, or to ask them what they want to do, or to ask them what might be best for them as they understand it, we're much more likely to actually make an impact with them that they can take in instead of feeling even more overwhelmed. Does that make sense? Comments, questions, thoughts, enthusiasms, worries? Please. Oh, that's, right. So in case you're fairly soft-spoken, so I want to make sure I'm understanding, and also just so everybody can hear, the question in terms of blame, what did you do to upset her? If you could address that to the partner, what were you upset, or what made you feel like you had the right to hit her, for example? Oh, the question here is directed specifically at the patient, because hopefully, and strongly encourage, these conversations would never happen in the presence of the partner, right? These are conversations that you have alone with the patient or the client. So that's why I'm glad I asked the clarifying question. So no, this is intended to direct, oh, well, the reason it says her is because of we're trying to put some very small, subtle indicators that it's not always in heterosexual relationships. Thank you. Now I understand where you're coming from in your question. And where I was going, because most of my life is in the prevention world, I was thinking that you were suggesting reframing the question, so rather than what did you do to upset her, is what made it okay for you to hit, which is where I come from, right, is let's reframe the conversation that's about the entitlement of the abuser to engage in abusive behavior. So a little bit of a tangent that I went off on, but thanks does that help? We're clear? Okay. Other comments, thoughts, questions? Okay. So a brief message on safety, confidentiality, and mandated reporting. Safety first, that's both for you and for your patient, client. Only give the card when you're alone. That's what I was just starting to talk about, right? Because of the risk of what happens afterwards, right? If you start asking questions, then the abuser might well respond to that in some really problematic ways later. So we want to make sure that we focus on safety. And again, that's for your own safety as well. If you seem to be interfering in the abuser's eyes, then your safety could be compromised as well. Make sure that you review the limits of confidentiality before disclosures start happening so that your client can make the decision about whether to disclose if it's something that would trigger a mandated report. And then make sure that you know your mandated reporting requirements. And other people in this room are more expert in mandated reporting than I am, but it is something that we want to make sure to acknowledge does exist, right? That mandated reporting does come up particularly around child abuse, and that is often part of an abusive relationship, as you might imagine. Comments, questions here? Does that make sense? Okay. So now we're going to start talking about these cards. One of the things I'm going to say is when you start this conversation, the most valuable thing you can do is normalize the conversation. You normalize the fact that you ask this of everyone, right? I'm not asking you because I think that there's something unhealthy in your relationship specifically, or that there's something wrong with you, in quotes. I ask this because we're asking this of everyone. Because domestic violence is so prevalent in our culture, we have started asking everyone that we do home visiting with these questions, right? So starting by normalizing that. We also, the simple fact of asking these questions also normalizes healthy relationships, right? It normalizes the expectation that abusive relationships are not the norm and are not acceptable. And I saw a few nods on that one. I think that's really one of the most valuable components of this work. And the scripts also, and I see it has the word should in it, which I really love. You can tell I didn't design these slides originally. The scripts, as much as possible, we would want them to address clients' fears about what might fall into the mandatory reporting requirements. So again, naming that up front is a really helpful way to go on that. What I'm going to ask is for a volunteer, if someone would be willing to just read this out loud. Anyone? Please. Okay, thank you. Right, so this is an example of a mandated reporting pre-disclosure, right? This is what I would have to talk about. Everything else is between us, so let's just talk, right? Again, normalizes the conversation. And again, if you start the conversation by saying, this is a conversation we're having with everyone, all of our clients, we go through this because it's so important and so meaningful in terms of the well-being and positive outcomes of the child. Thank you. And the safety card, as I said, if you haven't taken them out, please do so now. They look like this, yet again. These cards have been tested quite thoroughly, actually. Futures has done a ton of work to make these cards as good as they are. So they are evidence-based, and they combine both universal education, as was discussed in the back of the room, as well as embedded assessment. And what we saw in a randomized control group trial, so it's serious, that's the highest level of evaluation, right? A 71% reduction in the odds of pregnancy coercion among clients who had a history of DV within the last 3 months. 71% reduction. That's virtually unheard of in most social science, right? And then as well, people who received the card were more likely to end a relationship that felt unhealthy or they felt unsafe, regardless of whether they had a previous history of abuse. And again, I actually find that second statistic a little bit less exciting than the first one because it reinforces the idea that our goal is to get people to leave. It's not what our goal is, but this is what the client's goal was. They wanted to leave, and they were much more likely to do so after having had the intervention. So we're making a difference simply by choosing to use these cards. So I'm just going to ask you to take a minute, take a look at the card, ignore this first question. Think about how you'd introduce the card, what you'd say. This is one of the examples. It's basically what I said. And I love the example that's here. It's kind of like a magazine quiz. Well, you know, if you're working with younger clients, they're going to ask you what a magazine is, right? We're getting old very quickly. But one of the things that I really like about the card is just, it's the size and the shape, right? It's very unthreatening. It's easy to use, easy to look at, easy to conceal, if that's meaningful to the client. So It's a lot easier than a lot of the other tools that we've been given in our history. So how can the card support your screening during visits? How might you use it? Any thoughts up front? Do you see how this might be useful? Has anyone used these cards before? I've seen a couple of people have. That's great. Okay. Do you find that it made it easier for you to have these discussions with your clients? Sort of. Did you find it easy before the cards?
I remember. I think we did the assessment before.
Mm-hmm. Okay. It depends. Different people have used it differently, and there isn't a particular recommendation one way or the other. Some people do the assessment tool first and then use the card. Other people use the card and then the assessment tool. There are a lot of questions that overlap. In fact, more often people do the assessment, the paperwork, before using the card, and then basically the card is just a chance to actually go over and give people an opportunity to do more than just say yes or no, which was one of the criticisms that we had of those questions earlier, right? Thanks. The positive framing of this card is wonderful. It opens doors, absolutely. That's great, thank you. I agree with that. I think the positive and aspirational framing is really helpful. Anything else?
With the positive, it's not something that might be taken as a domestic violence tool.
Okay, yeah, because it's positive framing, it might not be seen as threatening in the same way as a lot of other things. Sure. Other? I saw one other hand.
No, it's just that it's small.
Mm-hmm.
It goes linear, like step by step.
Right.
And then you have it there, it's like, like it's
Right.
breaks it down.
Breaks it down into easily digestible components. And it's only 8 panels, right? This is not hard at all. Absolutely. Okay. So here, I mean, you've all seen this card, so these are just pictures in different ways. How's it going, right? On bad days, right? And this is one that's most closely connected to the assessment tool, right? Know your rights. If you don't, if this has been happening, what do we have to report? This is clarity about mandatory reporting. And again, I come back to one of the most important things that you can do as part of the normalization process is validating what the experience of the person you're speaking with your client looks like. Can reduce her sense of isolation and shame. It encourages her to believe a better future is possible. It's the hope that we were talking about, right? So that's such a key component of this. And we can say, I'm so sorry this is happening in your life. You don't deserve this. It's not your fault. I'm worried about your well-being. I'm worried about the safety of you and your children. This is all interconnected to that. If we get a disclosure, fairly simple set of steps that we want to follow, right? Validate the experience, offer the safety card, because that way, even if she doesn't want to take any actions at that moment, she can have the list of resources available to her at any time. Discuss where she can go to get more information and obtain birth control if that's valuable for her. Ask the client if she has any immediate safety concerns. You can discuss options around that. Refer the person to a DV advocate if you can. That's very valuable. One of the things that you'll find in your literature is a sample MOU, a sample memorandum of understanding that you might use with a domestic violence clinic or a resource center in your community. And please make sure you follow up at your next visit. People have disclosed this to you. They have given you a great deal of trust. And if you don't follow up, that might probably will feel like a violation of that trust, right? They've entrusted you with very important information, very personal, and even risky information. So ignoring it seems kind of problematic. Simple, clear, makes sense? So on pages 2 and 3 of the relationship assessment tool, we talk about safety planning, and it's also, well, Appendix F is in this curriculum, which is a very large book that Futures Without Violence puts out, again, free of charge, so if you're interested, but it's also included on your, on the relationship assessment tool as we talked about. At the end of the video, again, the presentation, again, we'll talk a little bit more about this. The card has resources, et cetera, et cetera. Providing a warm referral is extraordinarily valuable, and I'm going to show a video in a couple of minutes that will go through what the warm referral looks like. It's just the more you can encourage your client to talk to someone who's actually an expert in domestic violence dynamics, the more likely they'll be able to get help in the long run. And being able to hand off a warm referral, make the call yourself, hand them the phone with permission. Don't do it without permission, but encourage the person. You know, I know this person at the DV agency. They're great. They'll be able to help you. Would it be all right with you if I gave that person a call and had you talk to them? Right? That's what it would look like. And it's much more likely that they'll actually do it in that moment. We have safety planning, right? This is very clear. If there's immediate danger, calling 911, preparing an emergency kit, talking to your home visitor. And this is all on the card, right? And so it's right there in front of you for you and for your client to have that information. The DV advocate can help to give much more detailed safety planning and support, right? It's what they're there for. They're designed, the plan is designed to give people a way to think differently about their safety, right? To actually do a much longer term safety as opposed to survival plan is what we're ultimately looking for. And so you working in conjunction with a DV advocate can make a tremendous difference in moving forward. So you see on the back of the card, there are a bunch of resources listed, but they're all national resources. And that's great. The national resources are very good. I'll show it in large size. The national resources are great. I have been told by people at Futures, speaking off the record, that they encourage you to take stickers and put the local DV agency information right on top of their logo. They won't say that publicly, right? But off the record, that's why they made that space that way. So if you want to personalize these for your community, feel free. It's great. It's really helpful, and it moves things forward actually much more effectively if we can do it that way. So who would like to talk? Let's hear from some of the people who played the role of the home visitor. How did this feel? Is anyone willing to share how it felt to be the home visitor in this story? Please. Oh, you had an uncooperative partner, which is probably great modeling.
She was uncooperative, and she just told me she felt uncomfortable discussing it. So I said, okay, well, let's talk about your best friend.
Excellent. I like it.
We just did everything in terms of how do you think your friend feels about her relationship? Because I was hoping that in her mind she would still be thinking about her relationship.
Sure. That's such a great example, and it's so funny because everybody knows that what we're doing is talking about ourselves, and yet the evidence behind this is in evaluation research is so strong that when people talk about their best friends, they're talking about themselves, and they do it, and they're much more honest. And of course, we all know what's happening, and yet we're still there, right? So thanks, great idea. She still wasn't cooperative? Okay, that's fair. But I think it's a great strategy. Who else? Yeah?
Well, if this wasn't something that I, as a mom, needed or could use, maybe
Right.
I have a friend or a sister or somebody else, and
Sure.
she made it made it really comfortable to receive the card.
Oh, so you were playing the role of a client.
Uh-huh.
Okay, very good. Thank you. Who else? Any other people who were the visitors? How did it go? Any thoughts? Okay, how about then as clients, as people who were receiving the card? How did that go? Did anything make you feel particularly comfortable or uncomfortable? Did you see something that you're like, oh, I'm going to jot that down so that I can do it next time? Nothing? Wow. How about observer? Oh, please.
Well, I'm just going to say that she did normalize it.
She
in the
normalized.
very beginning. So it didn't sound like, she had suspicions about me or making judgments about me.
Very good.
And that did put me more at ease.
Excellent. Okay, great. Thank you. Thank you. Please.
My home also normalized it, but I think when I said something of that my partner wasn't very supportive or I was isolated, one of those, she said something along the lines of like that not all relationships are perfect and this is something you can do to make yourself feel better, or it just like really normalized it for me after
Even
that too.
Okay, so normalize it up front and then after some disclosure as well. Because that normalization process requires a lot of reinforcement, right? So very good. Okay, thank you. Anybody else, including anyone who observed? What did you observe that went really well? What would you like to have seen more of? Did you have ideas, like did you want to tag in and say, hey, try this instead? Anybody? Please, here and then here.
I was going to say something that was brought up while we were kind of looking at the card. Olivia made a good point about how at the first part, the how's it going,
Right.
if they say yes, it says if you answered yes to any of these questions, it's likely you're in a healthy relationship, and kind of how that can be true, but there could be things happening. So she kind of brought up that we still would want to keep going with it because
Yes.
we still want to get more information. So
Yes.
we don't want to stop at that point. So it's
Yeah, very well said. Yeah, that saying yes to the first questions, those are indicators of a healthy relationship. They are not assurances. Very well said. Thank you. So you keep going.
And I just wanted to share that because we were kind of trying to figure out the instructions initially, the home visitor started right on the bad days before,
Right.
and then we went back to the how's it going questions first.
Sure.
And as the parent, I realized that jumping right to the bad day questions threw me off a little bit, and that starting with these warmer questions definitely helped to open me up a little bit, which is making me think also about the assessment tool, which does kind of cut right to the chase, and how we can kind of warm that up before we start the assessment tool.
Sure. Okay, so that's an interesting idea, right? And that's a piece that I think is going to be different according to who the home visitor is in a particular moment, right? But the idea of it might be really helpful to start with the more positive questions, the more, hey, look at all of the things that are going well, potentially, rather than jumping right into the, wow, let's talk about awful stuff, right? So I think that's really valuable. And as you said, as the recipient, it really put you at ease. So I appreciate that. That makes a lot of sense. One thing to be aware of in that regard is that for some people, they feel like they don't have enough time to go through all of the questions, and so they might want to prioritize. That's also reasonable. The point of this card is that you can use it in a bunch of different ways. You can go through all of it. You can just ask one or two questions. You make multiple different visits, so you could do one panel per visit, for example. You do what works for you, but the most important thing is that you be comfortable and that you be consistent about being sure to ask questions, and then back to the normalizing and supporting and all of those pieces, right? Thanks.
Something I realized actually that the questions in the first two panel are yes or no answers. And that's actually helpful because when you're first starting to maybe disclose,
Right.
you kind of don't want to give the whole story right away. It's like safer to just kind of say, well, maybe, yeah.
Okay, so the first couple of questions can be yes or no, and that's all right as long as you're intending to follow up. And that's perfectly reasonable. And if you're using this in conjunction with the relationship assessment tool, which I'll start talking about in about 1 minute, is exactly that, right? You might do the relationship assessment tool first, which is yes or no, but they're also kind of, the hard-hitting, bad stuff questions. And then you can follow it up by going over the card and asking the more in-depth questions and really getting a responsive, that's sometimes called a conversation, right? Getting a conversation going as a way of moving forward and really getting at what's going on. Any other, please?
She did a really great job of normalizing it.
Mm-hmm.
And then as she started asking questions, she subconsciously answered the question for them. Are you
Interesting.
ever feeling threatened by your partner?
Wow.
And
Yeah.
so I just thought that that's a good observation that we need to be aware of, that our visual cues sometimes lead them in one direction or another.
It's so incredible the kinds of messaging we send off unintentionally. And so, are you ever feeling this way? Right? Yeah, we're telling you the answer we want you to give, aren't we? Right? So it's very straightforward. I remember when I was in a previous organization, I was going through kind of a challenging time at work, and I was feeling very negative, and everything was awful and blah. And one day I just decided, I need to change this. And so I've decided, and I was having this conversation with one of my colleagues, and I said, I've decided I'm really going to make a strong effort to be less negative. And I paused for a minute, and I was like, or I could try to be more positive, right? But it was so deeply embedded, right? This idea of, that I'm so stuck in negativity, right? I'm so stuck in this answer that even my efforts to get out of it are showing it. So the same kind of thing, right? That we really display so much of what we intend by those very small, I'm also a poker player. In poker, they're called microtells, right? It's not the big things. People don't do backflips when they get a good hand. They just, smile a little bit more. Or they, interestingly, make a fist. That's one of the strongest signs at a poker table, by the way, that someone has a strong hand. Don't know why that is, but that's what the research has shown. So yeah, we show these things a lot. Beth? Right?
A little bit, and I'm just sort of showing my, I don't know what.
You're showing something.
That the dialogue around normalizing that many people experience it. Like, I'm hoping that we're moving towards improving this rather than making it a normalized experience. And
Right.
I'm wondering if we should think about that.
That's really important. Thank you. And I think we want to normalize that we're asking questions of everyone, right? We want to normalize healthy relationships. And I would say we want to at least validate that many people have a similar experience. So now we often use the word normalize there as well, right? That yes, your experience is normal and common. And I think that's appropriate to say, yes, your experience is common. But I like where you're going with, we don't want to normalize the experience of being abused. We want to normalize the feelings that the survivor might have about being abused, right? What you're feeling makes perfect sense, and we understand that. Your response to an unacceptable situation is perfectly normal and natural, and we get that, including some feelings that we really don't want her to feel, like self-blame and shame and isolation, right? We want to get past it, but the fact that she's feeling it is absolutely normal. Does that make sense?
Yeah, I guess I just heard, and I don't doubt that this is an experience for many people.
Mm-hmm.
But when we talk about hope, I'm hoping that, it's my own hope.
Right.
I'm hoping that the normalized experience would be respectful.
Yes.
And maybe
Right.
that's part of my judgment.
Mm-hmm.
That I'm hoping for
Right.
and it feels like I'm hearing
Right.
normalized in a way
Mm-hmm.
that makes it a little.
In the prevention world, what you're describing, we talk about as being aspirational, right? We aspire that everyone would be in a healthy, healthy, free and safe relationship, for example, right? And so we are all moving in that direction, hopefully. And the way that we do that is by normalizing healthy relationships, by normalizing talking about this, by minimizing the shaming and blaming and isolation that are connected to that. I don't know if that, so this is all, but it's part of a process, and our language is changing as part of this, right? This is relatively new language even to talk about normalizing all of this, right? The way, back in the 70s, the way that we talked about this stuff was about, getting help for people, but it was very quiet, and we didn't talk about it, and we didn't, it was all very, very hush-hush because the shame levels were so high. We're getting past that now, and as we do so, our languaging is changing. So I think you're picking up on being at the cusp of a new change in language that we want to be careful that we're not normalizing the abuse, even if it is common, right? We're trying to change that. So I appreciate that clarification. Thanks. Okay, any final comments on this? We'll do a lot more, and I'm actually going to show a video in just a minute that's going to go through more of this. Please.
That may not come to fruition for a long time.
Absolutely.
Because she may feel very vulnerable and dependent on her partner and really just not have many options.
Right. The likelihood of economic isolation is very, very high just based on the fact that she's 24 and has 4 kids, you were saying. I think that's true. Not necessarily true, but there's an increased likelihood. And so being aware of that is very valuable. Planting, absolutely, or even in her own mind, even if it's not actually true, whatever actually true might mean. So finding ways to plant the seed. This is a conversation that might come to fruition later. And that's great. Doesn't have to be today. Doesn't have to be right now. Even if it's a year from now, it's still moving in the direction we want it to. Please. Yes, yes.
I wonder how useful it is. I think I think providers, it's really important to know the statistics. 1 in 4 women are, have experienced domestic violence throughout their lives.
Right.
And I'm just curious. Would that be useful in a conversation with a client, as a way of normalizing or just bringing up this is.
Well, I think that what I would suggest in terms of that is the challenge with statistics is that people like to fight them. People like to argue with them, and and there have been a lot of different statistics back to the 14 to 52%, right? At that point, when the range is that big, the statistics might not be meaningful. But if what you say is, from what I read, 1 in 4 or half or a third, whatever number happens to be the one that you're most comfortable using, this is what I understand to be the case, and that's why I think it's so important that we talk about it with everybody. So the statistics, I think, are a useful start, and what matters to me is the follow-up statement, the so what, and therefore I'm doing X, right? So I think that can lead to a good conversation. Thanks for that. Please. I did, yes.
On the one hand, it kind of makes sense to me. On the other hand, I'm kind of curious if you could just define that a little bit.
Sure. Economic isolation is it's a lot of words, and they're all big and multisyllabled, right? Multisyllabic. There we go. The challenge, the basic idea behind that is that if we don't have a lot of economic resources, then we often, as you say, particularly perceive that we have fewer choices in terms of, if I leave my partner, then these 4 kids and I are going to be even more impoverished, even more at risk, even more X, Y, and Z. And sometimes, that's not necessarily the case in this situation, but sometimes or even often, that's actually a part of what abusers use as a tactic. By controlling the money, we control the choices that our partner has. And so that's a piece of it. Actually, Kerry Washington just did a PSA on that very topic, on the use of economic abuse as part of domestic violence. Kerry Washington from Scandal, the television show. So it's out there and getting more attention. But I appreciate your calling me on my language. Thank you. On my using big words in a not so helpful way always. Thanks.